So the role of ctDNA is rapidly evolving, specifically in the early breast cancer space, but now as it's moving for therapeutic monitoring of efficacy in the advanced cancer space. So we specifically generated a cohort of patients in the first line and second line setting with ER positive, HER2 negative breast cancer, who are receiving first line endocrine therapy and CDK4/6 inhibitors, which is the standard of care therapy in that setting. And we so prospectively collected plasma samples at baseline and then serially in association with standard of care follow-up throughout a patient's time on therapy. And then we retrospectively analyzed them using the Guardant Infinity assay, which is a tumor-agnostic epigenomic and genomic-based assay, looking specifically at the changes in methylation, the methylation tumor fraction, or the amount of ctDNA over time with response to therapy, specifically with clinical response, but also radiographic response as well. And the interesting thing that we evaluated that we were able to identify is that patients who were responding to drug have corresponding changes and decreases in their ctDNA, which is quite interesting from a therapeutic monitoring perspective to select the patients where you can have early interventions who are not responding to therapy potentially as well. We also evaluated and were quite interested in tracking the emergence of novel resistant mechanisms to CDK4/6 inhibitors, which are well defined in the literature, like RB1 loss and cyclin E amplification. Because of the companion NGS panel that accompanies this specific assay, we're actually able to identify emerging genomic mutations that mediate resistance to CDK4/6 inhibitors prior to actual clinical progression. And thinking about sort of translating this into potential future prospective clinical trials, the ability to identify progression using the methylation tumor fraction or rise in the amount of ctDNA, but also the specific mechanism mediating resistance to the current therapy might give us the opportunity to actually assess this in a randomized controlled trial where we can intervene in a matched drugs with the specific mutations that are evolving.